Most people think colon cancer begins the day a doctor finds a tumor. But the truth is, the battle may begin years earlier, inside your gut, inside your immune system, inside your daily meals, and even inside the tiny blood vessels that can feed a growing tumor before you ever feel a symptom. Stage 4. Colon cancer is frightening. I do not want to soften that. When cancer has spread beyond the colon, it is serious, and it requires real medical care. But here is what most people are never told clearly enough. Some advanced colon cancers can respond dramatically when the immune system is properly activated by modern treatments. And the food you eat every day may help support the same defense systems your body uses to recognize abnormal cells, calm inflammation, nourish protective gut bacteria, and make it harder for cancer to build the environment it needs to grow. This does not mean food replaces chemotherapy, immunotherapy, surgery, radiation, screening, or your oncologist. It means your daily choices may help create an internal environment where cancer has a harder time gaining momentum and your body has a better chance to respond. Before we begin, subscribe to the channel and comment colon below if you want more science-based videos on cancer prevention, gut health, and foods that support your body after 50. Now, let me begin with the uncomfortable trend doctors are seeing more and more often. For decades, colorectal cancer was thought of as a disease that mainly affected older adults. In medical training, when someone in their 20s, 30s, or early 40s came in with colon cancer, it felt unusual. It was the kind of case that made people stop and ask, why did this happen so young? Today, that question is being asked far too often. We are seeing more younger adults diagnosed with colorectal cancer, including people who look healthy from the outside, people who exercise sometimes, people with careers, young families, and decades of life ahead of them. And while genetics can play a role, genetics alone cannot explain the speed of this shift. Our genes do not change that dramatically in one generation. Something in the environment around us has changed. Something in our food supply, our movement patterns, our sleep, our stress, our alcohol habits, our gut bacteria, and our daily routines appears to be pushing the biology of the colon in a more dangerous direction. One of the most obvious changes is the rise of ultra-processed food and processed meat. Bacon, sausage, hot dogs, pepperoni, deli meats, ham, and many packaged meats are convenient, salty, flavorful, and everywhere. But processed meats have been classified as carcinogenic to humans, with the strongest link being colorectal cancer. That does not mean one slice of bacon causes cancer, but it does mean that frequent exposure matters. Your colon is not just a passive pipe. It is living tissue. It is lined with cells that are constantly renewing, constantly interacting with bacteria, bile acids, inflammatory signals, and the chemicals produced as food is digested. When processed meat sits in the colon, compounds such as nitroso compounds, heme iron, and chemicals formed during high-temperature cooking can increase oxidative stress and irritation in the lining of the bowel. Over time, repeated irritation can create an inflammatory environment, and inflammation is one of the key background conditions in which cancer becomes more likely. Cancer is rarely one single event. It is usually a long accumulation of small injuries, failed repairs, genetic mistakes, immune escape, and environmental pressure. At the same time, most people are eating far less fiber than the body is designed to use. Fiber is not just something that helps you use the bathroom. Fiber is food for your gut bacteria. When you eat beans, lentils, oats, barley, berries, vegetables, and intact whole grains, your gut bacteria ferment those fibers and produce short-chain fatty acids, especially butyrate. Butyrate is one of the most important compounds for colon health. It helps nourish the cells lining the colon, supports the gut barrier, and helps regulate inflammation. When fiber disappears from the diet, the gut microbiome changes. The bacteria that protect you become less abundant. The bacteria that thrive on mucus and inflammatory conditions can become more dominant. Transit time slows. Waste sits in the colon longer. The colon lining is exposed for longer periods to compounds that may irritate it. That is one reason a low-fiber, high-processed food diet is such a dangerous combination. It removes the protective inputs while increasing the damaging ones. Then add sedentary living. Sitting for long stretches, day after day, changes metabolism. It worsens insulin sensitivity, promotes weight gain in many people, reduces gut motility, and increases inflammatory signaling. Your colon was designed for a moving human body. Even a simple 30-minute walk most days can improve bowel motility, blood sugar control, immune activity, and inflammation. You do not need to become an athlete to lower risk, but a body that barely moves becomes a body with weaker defenses. Alcohol adds another layer. Alcohol can damage DNA directly and interfere with folate metabolism, which matters because folate is involved in DNA repair and cell division. Smoking is also clearly linked with higher cancer risk. And although vaping is still being studied in many areas, inhaling heated chemicals is not a harmless habit. Chronic stress and poor sleep matter too. They can alter immune function, raise inflammatory hormones, and make it harder for the body to repair itself. And here is the most dangerous part. Colon cancer can grow quietly for years before symptoms become obvious. A person may feel normal while polyps are forming. They may feel normal while early cancer is developing. They may blame subtle bowel changes on stress, diet, hemorrhoids, or aging. That is why prevention, screening, and symptom awareness are so important. Colon cancer is often highly treatable when found early, but it becomes much more dangerous when found late. To understand how food and lifestyle fit into this picture, you have to understand one of the body's most powerful cancer defense systems: immune surveillance. Every day, cells in your body divide. Every day, mistakes can happen when DNA is copied. Most of those mistakes are repaired. Some cells are eliminated. Some abnormal cells appear and disappear without you ever knowing because your immune system finds them before they become dangerous. Think of your immune system like a highly trained security force. Natural killer cells, T cells, macrophages, dendritic cells, and many other immune players are constantly sampling, scanning, and responding. Natural killer cells can attack abnormal cells without needing a long training process. T cells can recognize specific signals and mount a targeted response. Dendritic cells help present information to the immune system so it knows what to attack. This is not science fiction. This is happening in you right now. But cancer cells are clever. A cell that becomes abnormal does not immediately become a deadly tumor. First, it has to survive. It has to avoid being destroyed. It has to adapt. It has to create signals that protect it. It has to live in an environment that allows it to grow. When your immune system is strong and well regulated, many abnormal cells never make it past this early stage. When immune surveillance is weakened, more abnormal cells can slip through. What weakens immune surveillance? Chronic inflammation is one of the big ones. An immune system that is constantly irritated by poor sleep, excess alcohol, smoking, highly processed foods, abdominal obesity, uncontrolled blood sugar, and a damaged gut barrier can become less precise. It may be activated in the wrong way, but less effective in the way you need most. That is an important distinction. Inflammation is not the same as good immunity. A house can have smoke alarms blaring all day and still have poor security. Your gut bacteria also train your immune system. The gut is one of the largest immune organs in the body because it is where the outside world meets the inside world. Every meal introduces new compounds. Every bite interacts with bacteria. The lining of your gut has to decide what is harmless, what is helpful, and what is dangerous. A healthy microbiome helps the immune system stay educated and balanced. A disrupted microbiome can push the immune system toward inflammation, confusion, and weaker defense. This is where people often misunderstand cancer prevention. They think it is only about avoiding carcinogens. That matters, of course. But it is also about strengthening the systems that identify abnormal cells early. It is about building a body that repairs damage, controls inflammation, maintains a healthy gut barrier, and keeps immune cells sharp. Prevention is not one magic food. It is a biological pattern repeated every day. But even if a cancer cell escapes the immune system, it still faces one more barrier. It needs blood. This is where the idea of starving cancer becomes scientifically interesting, but also where we have to be very careful with language. Starving cancer does not mean you can eat one food and make a tumor vanish. It does not mean a diet can replace cancer treatment. What it means is that tumors depend on supply lines. Like any growing tissue, they need oxygen and nutrients. And to get those supplies, they often need to recruit new blood vessels. The growth of new blood vessels is called angiogenesis. Your body uses angiogenesis in healthy ways. You need new blood vessels when wounds heal. Women need controlled angiogenesis during the menstrual cycle and pregnancy. Blood vessels are not bad, but the body has to regulate them carefully. Too little blood vessel growth in tissues cannot repair. Too much abnormal blood vessel growth and disease can accelerate. Cancer can hijack this system. Tumor cells can release chemical signals that tell the body, build blood vessels here. One of the most important signals is called VEGF, vascular endothelial growth factor. You can think of VEGF like a construction signal that encourages new vessels to grow toward the tumor. Once a tumor has access to a stronger blood supply, it can receive more oxygen, more glucose, more amino acids, and more growth signals. It can also gain more roots to spread. This is why some cancer drugs are designed to interfere with angiogenesis. Bevacizumab, known by the brand name Avastin, targets VEGF and is used in certain colorectal cancer treatment plans. But foods are not drugs, and we should not pretend they are. What we can say is that certain foods contain compounds that have been studied for their ability to influence inflammation, blood vessel signaling, oxidative stress, and cancer-related pathways. These compounds may help support a healthier internal environment, especially when they are part of a consistent dietary pattern. And this is why cancer prevention is not only about killing cancer cells, it is also about making your body a place where cancer struggles to build a supply line. It is about lowering the background inflammation that helps tumors communicate. It is about supporting the immune cells that recognize abnormal growth. It is about feeding the gut bacteria that help regulate immune tone. It is about changing the terrain. Now, the most dramatic example of the immune system fighting cancer comes from immunotherapy. This is one of the most important advances in cancer care in the last several decades. Chemotherapy often works by attacking rapidly dividing cells. That can include cancer cells, but it can also affect healthy cells that divide quickly, which is why side effects can occur. Immunotherapy works differently. In many cases, it does not attack the cancer directly. It helps your own immune system see the cancer more clearly. Cancer cells can hide from the immune system by using checkpoint signals. These checkpoints are normal safety systems. They prevent your immune cells from attacking healthy tissue too aggressively. But cancer can exploit those checkpoints like a disguise. It can send signals that tell T cells, "Do not attack me, I am safe." Checkpoint inhibitor drugs can block those signals and remove part of the disguise. Pembrolizumab, nivolumab, and ipilimumab are examples of immunotherapy drugs used in certain cancer settings. Pembrolizumab and nivolumab target PD-1, an immune checkpoint found on T cells. Ipilimumab targets CTLA-4, another checkpoint involved in immune regulation. When these checkpoints are blocked in the right patient, the immune system may become much better at recognizing and attacking cancer cells. But this is the part that must be said clearly. Not every colon cancer responds to immunotherapy. Some do. Some respond dramatically. Some patients with the right tumor biology can experience deep, durable, and even complete responses. But many colorectal cancers do not respond well to checkpoint inhibitors because they do not have the molecular features that make them highly visible to the immune system. One of the most important markers is MSI-H, which stands for microsatellite instability high. Another related term is dMMR, mismatch repair deficient. These tumors have defects in the DNA repair machinery. Because of that, they accumulate many mutations. Those mutations can make the cancer look more foreign to the immune system. When checkpoint inhibitors remove the brakes, immune cells may be more likely to recognize and attack the tumor. This is why tumor testing is so important. If you or someone you love is diagnosed with colon cancer, especially advanced colon cancer, ask the oncology team whether the tumor has been tested for mismatch, repair deficiency, microsatellite instability, and other relevant molecular markers. Depending on the case, doctors may also evaluate KRAS, NRAS, BRAF, HER2, and other tumor features that guide treatment. PD-L1 may be discussed in some cancers, but in colorectal cancer, MSI-H and dMMR are especially important for immunotherapy decisions. This is precision medicine. It is not one treatment for everyone. It is finding the biological fingerprint of the tumor and choosing treatment based on that fingerprint. That is why no one should hear this video and think, "I will just eat better instead of getting treated." No. If cancer is present, the first step is proper diagnosis, staging, molecular testing, and a serious treatment plan with an oncology team. Nutrition can support the body, but it should work alongside medical care, not in place of it. Now, here is where the story becomes even more fascinating. The immune system does not operate in isolation. It is influenced by the gut microbiome. Those trillions of bacteria living inside your digestive tract are not just passengers. They produce metabolites. They train immune cells. They help maintain the gut barrier. They influence inflammation throughout the body. And emerging research suggests that the microbiome may affect how some people respond to immunotherapy. One bacteria that has attracted a lot of attention is Akkermansia mucinifera. Akkermansia lives near the mucus layer that protects the intestinal wall. In a healthy gut, that mucus layer acts like a protective shield. It helps separate bacteria and food particles from the immune-rich tissue underneath. Akkermansia appears to play a role in maintaining that mucus environment and supporting metabolic and immune health. Some studies have found that people who respond better to certain immunotherapy treatments may have different gut bacteria than people who do not respond. Akkermansia has appeared in some of that research as a potentially important organism. But let me be precise. Having more Akkermansia does not guarantee that cancer treatment will work. Taking a probiotic does not cure cancer. The microbiome is complex, but supporting a diverse, resilient, healthy gut environment may help create better immune conditions, and that is something we can influence with daily food choices. So what feeds beneficial bacteria like Akkermansia and other protective microbes? Polyphenol-rich plant foods and fiber-rich foods appear to be especially important. Pomegranate is one of the most interesting examples because it contains L-gitannins, plant compounds that gut bacteria can transform into metabolites called urolithins. Cranberries, walnuts, raspberries, strawberries, and some other foods also provide related compounds. Oats and oatmeal provide fibers that support a healthier microbial community. Beans and lentils feed short-chain fatty acid-producing bacteria. The pattern matters more than one single food. This is why I am cautious when people ask, what supplement should I take for my gut? Sometimes supplements have a place, especially under medical guidance. But your microbiome is not built by a capsule alone. It is built by repeated meals. It is built by what you feed it. Breakfast after breakfast, dinner after dinner, week after week. Your gut bacteria are like a garden. If you keep feeding weeds, weeds grow. If you feed diversity, diversity grows. In a few minutes, I will give you a practical food protocol you can start using without expensive powders, detox kits, or miracle products. But first, let's look at the food groups that have the strongest logic behind them when we talk about inflammation, blood vessel signaling, gut health, and colorectal cancer risk. Green tea is one of the most studied. It contains catechins, especially EGCG, which has been studied for antioxidant, anti-inflammatory, and anti-angiogenic activity in laboratory models. Human population studies have linked regular green tea consumption with lower risk of several chronic diseases, and some studies have found associations with lower colorectal cancer risk. But remember the word, associated. Green tea is not a treatment for cancer. It is a daily beverage that may support a healthier internal environment when it replaces sugary drinks or alcohol and fits into an overall protective pattern. Tomatoes are another important food because they contain lycopene, a carotenoid pigment that becomes more available when tomatoes are cooked. This is why tomato sauce, tomato paste, roasted tomatoes, and stewed tomatoes can sometimes deliver more usable lycopene than raw tomatoes. And because lycopene is fat-soluble, pairing cooked tomatoes with extra virgin olive oil improves absorption. That is a beautiful example of food synergy. The tomato provides the lycopene. The olive oil helps carry it into the body. Cruciferous vegetables deserve special attention. Broccoli, Brussels sprouts, kale, cabbage, cauliflower, arugula, bok choy, and broccoli sprouts contain glucosinolates, which can be converted into compounds such as sulforaphane and isothiocyanates. Sulforaphane has been studied for its role in supporting detoxification enzymes, antioxidant defense, and pathways involved in inflammation and cell protection. Broccoli sprouts are especially concentrated, often containing much higher levels of sulforaphane precursors than mature broccoli. But preparation matters. Boiling cruciferous vegetables until they are soft and lifeless can reduce some of the beneficial compounds. Light steaming, gentle sautéing, or eating some of them raw can preserve more benefit. Whole soy foods are often misunderstood. Many people have heard that soy is dangerous because it contains phytoestrogens. But phytoestrogens are not the same as human estrogen, and whole soy foods have been associated in many population studies with favorable health patterns. Soy contains isoflavones such as genistein, which has been studied for effects on cell signaling and angiogenesis pathways. The key is to choose whole or minimally processed soy. Tofu, tempeh, edamame, miso, and unsweetened soy milk. That is very different from eating ultra-processed foods built around isolated soy protein, refined oils, and additives. Extra virgin olive oil is another cornerstone. High-quality extra virgin olive oil contains monounsaturated fat along with polyphenols such as hydroxytyrosol and oleocanthal. These compounds have been studied for anti-inflammatory effects. Olive oil is one reason traditional Mediterranean-style eating patterns are associated with better cardiovascular and metabolic health. And metabolic health matters for cancer risk because insulin resistance, abdominal obesity, chronic inflammation, and poor vascular health often travel together. Seafood and omega-3 fats also matter because they help the body produce less inflammatory lipid mediators. Fatty fish such as salmon, sardines, trout, mackerel, and anchovies are especially rich in EPA and DHA, but even some shellfish and lean fish can contribute useful nutrients. If you do not eat seafood, ground flaxseed, chia seeds, walnuts, and algae-based omega-3 can help, though plant omega 3 conversion to EPA and DHA is limited in many people. Again, this is not about perfection. It is about building a pattern your body can use. Now, let's turn this into a practical daily protocol. I want you to think of this as 5 pillars, not 5 rules you must follow perfectly. The goal is not to make your life stressful. The goal is to make your meals more protective, one step at a time. The first pillar is fiber first. For most adults, a strong target is about 25 to 30 grams of fiber per day for women and about 30 to 38 grams per day for men. Many people are getting less than half of that. If you are currently eating very little fiber, do not jump overnight from 10 grams to 40 grams. Your gut will protest. Start gradually. Add half a cup of beans to lunch 3 or 4 times per week. Add oatmeal a few mornings per week. Add berries instead of a processed dessert. Increase water as fiber goes up. Beans and legumes are some of the most powerful foods for colon health. Black beans, pinto beans, lentils, chickpeas, white beans, split peas, and kidney beans provide fiber, resistant starch, plant protein, minerals, and polyphenols. A cup of cooked beans can provide around 12 to 15 grams of fiber, depending on the type. That is a huge step toward your daily goal. If beans make you bloated, start with smaller portions. Rinse canned beans well, cook them thoroughly, and build slowly. Your microbiome often adapts. Oats, barley, brown rice, quinoa, and whole wheat can also help, but choose intact or minimally processed grains when possible. Oatmeal is especially useful because it contains beta-glucan, a soluble fiber that supports cholesterol metabolism and feeds beneficial bacteria. A bowl of oatmeal with berries, ground flaxseed, and walnuts is not just a breakfast, it is a microbiome meal. The second pillar is polyphenols every day. Polyphenols are plant compounds that give foods color, bitterness, astringency, and many of their protective effects. Berries are one of the easiest ways to get them. Aim for 1 to 2 cups of berries most days if you can. Blueberries, strawberries, raspberries, and blackberries each contain different anthocyanins and related compounds, so rotate them. Frozen berries are fine. In fact, they are often more affordable and picked at peak ripeness. Pomegranate and cranberries are also excellent polyphenol sources. For pomegranate juice, choose 100% juice with no added sugar and keep the portion reasonable, about 4 to 8 ounces. Because juice can be concentrated in natural sugar, you can also use fresh pomegranate seeds on yogurt, oatmeal, or salads. Cranberries are often sold sweetened, so look for unsweetened or lightly sweetened options, or use them in small amounts. Green tea can become a simple daily habit. 2 to 3 cups per day is reasonable for many people, as long as caffeine does not bother your sleep, heart rhythm, anxiety, or reflux. Do not use boiling water. Let the water cool slightly, then steep for about 3 to 5 minutes. Adding lemon may improve the stability and absorption of some catechins. Avoid turning green tea into a sugar drink. The benefit is not in a bottled sweet tea loaded with sugar. It is in the tea itself. Coffee also contains polyphenols, including chlorogenic acids, and regular coffee consumption has been associated with lower risk of several chronic diseases in many studies. If you tolerate coffee, 2 to 3 cups earlier in the day can fit into a healthy pattern, but if coffee triggers palpitations, anxiety, reflux, or poor sleep, do not force it. Sleep is also a cancer defense habit. The third pillar is healthy fats. Extra virgin olive oil should be one of your default fats. 2 to 4 tablespoons per day can fit well for many adults, depending on calorie needs. Use it on salads, cooked vegetables, beans, and tomato-based dishes. Look for extra virgin olive oil in a dark bottle with a harvest date, if possible, and a peppery taste. That peppery sensation is often a sign of polyphenols. For omega-3s, aim for seafood about 3 times per week if it fits your diet and health needs. A serving is roughly 4 ounces cooked. Sardines, salmon, trout, and anchovies are excellent. Shrimp, mussels, clams, and cod can still contribute useful nutrients. If you are vegetarian or vegan, use ground flaxseed, chia seeds, walnuts, and consider speaking with a clinician about an algae-based EPA and DHA supplement, especially if you have higher inflammatory or cardiovascular risk. The fourth pillar is cruciferous vegetables. Try to eat them at least 4 times per week, and daily is fine for many people. Broccoli sprouts are especially potent, and a small handful a few times per week can be a powerful addition. You can add them to salads, eggs, avocado toast, soups after cooking, or grain bowls. Do not cook broccoli sprouts aggressively. If you cannot find sprouts, regular broccoli, Brussels sprouts, kale, cabbage, and cauliflower are all valuable. Preparation matters here. Lightly steam broccoli for about 3 to 4 minutes until it turns bright green and tender crisp. Do not boil it into mush. If you chop broccoli and let it sit for 40 minutes before cooking, it may help the enzyme activity involved in forming sulforaphane. Another trick is to add a pinch of mustard seed powder after cooking, because mustard seed contains myrosinase, the enzyme that helps convert precursors into sulforaphane. The fifth pillar is whole soy foods. 2 to 3 servings per week is a reasonable target, and some people may eat them more often. Tofu in a stir-fry, tempeh in a bowl, edamame as a snack, miso in soup, or unsweetened soy milk in oatmeal are practical options. If you have a history of hormone-sensitive cancer, thyroid disease, or take certain medications, ask your clinician how soy fits your personal situation. But for most people, whole soy foods are very different from the fear-based myths you may have heard online. Now, here is the secret that most people miss. The secret is not one miracle food. It is the daily repetition of foods that feed your microbiome, calm inflammation, and support immune function. A cup of berries once a month will not transform your biology. A green tea here and there will not undo a highly processed diet. But beans several times per week, berries most mornings, green tea or coffee instead of soda, olive oil instead of refined oils, cruciferous vegetables several times per week, seafood regularly, and processed meats only rarely or not at all. That pattern changes the signals your body receives. Timing can help too. Try not to eat your largest meal right before bed, especially if you have reflux, poor sleep, or digestive symptoms. Your body does important repair work at night, and heavy late meals can interfere with sleep quality. That does not mean you should fear food after sunset. It means you should give your body time to digest. A good rule for many people is to finish larger meals about 3 hours before lying down. Hydration matters as fiber increases. When you raise fiber but do not raise fluid, constipation can worsen. Movement matters too. A 10 to 15-minute walk after meals can help blood sugar, digestion, and bowel motility. This is one of the simplest habits for people over 50 because it supports independence, energy, weight control, and gut function at the same time. Now let me warn you about the common mistakes that weaken this entire strategy. The first mistake is inconsistency. People hear about a protective food, eat it twice, and then forget about it. Biology responds to repetition. You brush your teeth every day because plaque returns every day. You feed your gut every day because your gut bacteria respond every day. Consistency beats intensity. The second mistake is trying to replace whole foods with supplements. Fiber powders, omega-3 capsules, green tea extracts, curcumin, mushroom blends, and polyphenol capsules are everywhere. Some may have value in specific situations, but they do not replace food synergy. A blueberry is not just anthocyanins. It is fiber, vitamin C, vitamin K, manganese, water, acids, and dozens of interacting compounds. Beans are not just fiber, they are resistant starch, minerals, protein, and microbial fuel. Whole food complexity is part of the benefit. The third mistake is preparing foods in ways that erase some of their value. Tomatoes become more useful when cooked with olive oil. Broccoli should be lightly steamed, not boiled to death. Green tea should be steeped gently, not scorched with aggressively boiling water. Flaxseed should be ground, not swallowed whole, because whole flaxseed often passes through undigested. Canned beans should be rinsed if sodium is a concern. These details are small, but they add up. The fourth mistake is ignoring personal medical context. If you are receiving chemotherapy, immunotherapy, radiation, or surgery, do not add high-dose supplements without telling your oncology team. Some supplements can interact with treatment, affect bleeding risk, alter liver enzymes, or worsen side effects. Food is usually safer than concentrated extracts, but even diet changes should be discussed if you are actively being treated or losing weight unintentionally. During cancer treatment, maintaining strength and adequate protein can be just as important as eating protective plants. The fifth mistake is confusing prevention support with diagnosis. If you have blood in your stool, persistent changes in bowel habits, unexplained weight loss, ongoing abdominal pain, new iron deficiency anemia, pencil-thin stools that persist, or a feeling that your bowel does not empty normally, do not try to solve that with berries and green tea. Call your doctor. Get evaluated. If you are 45 or older and average risk, ask about colorectal cancer screening. If you have a family history, inflammatory bowel disease, known genetic risk, or symptoms, you may need screening earlier. This matters because colorectal cancer is one of the cancers where screening can actually prevent disease, not just detect it. Colonoscopy can find and remove precancerous polyps before they turn into cancer. Stool-based tests can detect signs that need follow-up. The best test is the one you actually complete, but if a test comes back abnormal, follow-up is not optional. Do not let fear delay you. Fear grows in silence. Action gives you options. I want you to leave this video with hope, but not false hope. Colon cancer is frightening because it often grows silently. But silence does not mean helplessness. Your body has defense systems working every day. Your immune system, your gut bacteria, your blood vessel controls, your inflammation response, your detoxification enzymes, your DNA repair systems. The question is whether your daily habits are supporting those systems or weakening them. Processed meats, low fiber intake, sedentary living, excess alcohol, smoking, poor sleep, and poor gut health can push the body toward inflammation and higher risk. Modern immunotherapy can be powerful in the right patients, especially when tumors have features like MSI-H or dMMR, but it is not a universal answer for every colon cancer. Gut bacteria may influence immune response, but they do not replace treatment. Foods like beans, lentils, berries, pomegranate, green tea, coffee, extra virgin olive oil, broccoli sprouts, cruciferous vegetables, seafood, walnuts, oats, and whole soy foods are not magic bullets. They are daily tools that help support the terrain your cells live in. Start with one change today. Add beans to one meal. Take a walk after dinner. Replace processed meat at breakfast with oatmeal, berries, and walnuts. Brew green tea instead of a sugary drink. Buy frozen berries. Add olive oil to cooked tomatoes. Put broccoli sprouts on a salad. Schedule the colon cancer screening you have been postponing. Small choices repeated consistently can become powerful. And if you are already facing colon cancer, please hear me carefully. You did not cause this with one meal, and you should not try to treat it alone. Work with your oncology team. Ask about tumor testing. Ask about MSI-H and dMMR. Ask what treatment options fit your biology. Then use nutrition, movement, sleep, and gut health as support for your strength, your immune system, your recovery, and your quality of life. Your genes matter, but they are not the whole story. Your diagnosis matters, but it is not the whole story. Every day, your body is listening to the signals you send it. Send signals of repair. Send signals of nourishment. Send signals that support the defenses you already have. If this video helped you, subscribe, give it a like, and comment fiber below. And if you know someone over 45, someone with a family history of colon cancer, or someone who keeps putting off screening, share this with them today. It could be the reminder that gets them checked before it is too late. In the next video, I will show you the everyday bowel changes people often ignore, and how to know when a symptom is just digestion and when it needs a doctor's attention.